Have you ever felt an itch that just wouldn't go away? One that seemed harmless at first, but kept coming back, no matter what you did? For many older adults, these itches aren't just about dry skin or seasonal changes. In some cases, they're quiet warnings, gentle but persistent messages from the body, trying to tell you that something deeper is happening beneath the surface. As we age, our bodies speak in softer tones. Not all symptoms come with pain or panic. Some arrive as whispers, subtle signs that are easy to overlook. But ignoring them could mean missing the early clues of something more serious. In today's video, we're going to uncover 3 specific itchy spots on the body that may be more than just irritating. They could be early indicators of serious underlying health conditions. And in certain cases, they've even been linked to shortened lifespans when left unexamined or untreated. You'll learn the science behind why these particular areas matter, discover how your skin and internal systems are deeply connected, and hear powerful real-life stories of what can happen when we choose to listen or not to what our bodies are trying to say. Because your skin doesn't lie. It may not shout, but it does speak. And today, we're going to help you understand what it's trying to tell you before it's too late. Let's begin. Itchy spot number 1, armpits, a hidden warning of diabetes. It usually begins as something small, a mild tickle under the arm, a momentary itch you brush off without thinking. But over time, that little itch becomes persistent, then relentless. Eventually, your armpits feel like they're constantly irritated, raw, burning, and impossible to ignore. For seniors, this kind of chronic itching in the armpits isn't always just about dry skin or poor hygiene. In many cases, it could be one of the earliest, most overlooked signs of diabetes. You see, when blood sugar levels remain high over time, the body's natural systems begin to falter, especially the skin and the nerves. Diabetes disrupts sweat and oil production, particularly in older adults, leading to excessive dryness. And while dry skin may affect the entire body, the armpits are often among the first areas to react. Why? Because armpits are warm, moist, and constantly in motion. That combination creates the perfect storm. Dry, irritated skin on the surface and excess moisture trapped underneath. And if someone is overweight, the problem intensifies. Extra body weight increases sweating, making it easier for bacteria and fungi to grow in the fold of skin, causing even more itching, inflammation, and discomfort. The result is a cycle that feels impossible to escape. You scratch to relieve the itch, but the skin only becomes more irritated. You apply lotions, but nothing seems to help. And worst of all, it begins affecting your sleep, your confidence, and your ability to go about daily life comfortably. But what many don't realize is this. Itching in the armpits, especially when it seems to appear out of nowhere and doesn't respond to treatment, can be your body's way of warning you about rising blood sugar levels. Here's what to watch for. Persistent itching with no visible rash or redness. Symptoms that worsen in cold, dry seasons. No relief from over-the-counter creams or moisturizers. Accompanying fatigue, increased thirst, or unexplained weight changes. This isn't just about skin health. It's about the entire system breaking down quietly. And diabetes often works this way. It doesn't always scream its arrival. It whispers through subtle symptoms like skin issues, nerve sensitivity, and recurring infections. If you or someone you love is experiencing this type of armpit itching, don't just cover it up. Get to the root. A simple blood test could reveal whether diabetes or prediabetes is to blame. And catching it early could mean avoiding serious complications down the road, including nerve damage, kidney trouble, and even vision loss. Remember, your body doesn't complain without a reason. Sometimes, an itch is more than just an itch. It's a signal, and paying attention could save your life. Itchy spot number 2, anal region. When the itch runs deeper than you think. This is a topic many avoid, often out of embarrassment, but it's one we need to talk about openly, especially in older adults. Persistent itching in the anal region. At first, it may seem like nothing more than a minor annoyance. A small itch on one side, perhaps after using a restroom or sitting for long periods. You assume it's just irritation or dry skin, but as days turn into weeks, that itch starts to grow. It becomes more frequent, more intense, and for many, it worsens at night, disrupting sleep, peace of mind, and overall well-being. This kind of itching isn't just uncomfortable. It can be a red flag for something more serious lurking beneath the surface. One of the most common culprits? Hemorrhoids. These swollen blood vessels in the rectal area can cause significant itching, discomfort, and even bleeding. And yet, they often go undiagnosed until the symptoms become unbearable. Then there are anal fissures, tiny tears in the skin that can cause sharp pain and severe irritation, especially during bowel movements. But there's a darker possibility that many don't consider: rectal or anal cancer. These conditions often begin with mild symptoms, like itching or feeling of fullness, and slowly progress without warning. In some cases, the only early symptom is a relentless itch that won't go away. That's why persistent anal itching, especially when paired with other signs like bleeding, noticeable pain, weight loss, or changes in bowel habits, should never be ignored. It's not just dry skin. It's your body speaking, and you need to listen. Other possible causes include anal fistulas, which are abnormal passages caused by infection that can lead to drainage and irritation. Fungal or bacterial infections also thrive in warm, moist environments like the anal region, particularly in individuals with diabetes, obesity, or poor hygiene practices. What makes this symptom especially dangerous is how easily it's dismissed. Many older adults are too embarrassed to bring it up to a doctor. They try creams, change their soaps, or blame it on diet. And while these may offer temporary relief, the root cause often remains hidden. Let's be clear. Anal itching is not just a skin issue. It can be the very first clue that something deeper, something dangerous, is happening inside the body. If this is something you or someone you love is experiencing, the most important step you can take is to seek medical evaluation. A doctor can perform a quick and painless exam, run simple tests, and rule out or identify serious conditions early on when they're still treatable. You have nothing to be ashamed of, but everything to gain by speaking up. Because sometimes the symptoms we're most reluctant to talk about are the ones that save our lives. Itchy spot number 3, genital area. And the itch is a whisper from your microbiome. For many older women, few things are more distressing or isolating than persistent itching in the genital area. It's a topic often left unspoken, a private discomfort endured in silence. But this itch, as uncomfortable as it may be, could be trying to tell you something important, something deeper than just age or dryness, something your body needs you to hear. While many assume that genital itching after 60 is just another symptom of menopause or hormonal shifts, the truth is far more complex and potentially serious. This type of itching is often caused by a disruption in the body's natural defense system, the vaginal microbiome. When this delicate ecosystem becomes unbalanced, good bacteria are overrun by harmful microbes. This leads to inflammation, burning sensations, persistent redness, and an itch so deep that even most expensive creams can't provide relief. This isn't just a surface-level irritation. It's a signal of internal imbalance, your body's way of waving a red flag. Conditions like vaginitis, vulvitis, eczema, genital warts, and even scabies are common culprits. Each brings its own challenges, but they share a common thread. They all weaken the skin's natural barrier and make you more vulnerable to infections. And for aging women, whose immune responses are naturally slower, this makes the situation even riskier. What begins as an occasional itch can soon become a cycle of scratching, skin damage, and further irritation. Tiny tears from constant scratching create entry points for bacteria, leading to secondary infections. Pain during urination, swelling, or unusual discharge might follow, adding physical discomfort to an already emotional burden. What should you look out for? Persistent itching that doesn't go away after hygiene changes. Redness, swelling, or sensitivity that lingers. Burning sensations during urination. Discharge that seems unusual in color or smell. No improvement despite using over-the-counter creams or powders. These aren't just symptoms of discomfort. They're possible signs of a weakened immune defense or an underlying gynecological condition that needs medical attention. The longer the issue goes unaddressed, the greater the risk of more serious infections, skin breakdown, or complications that impact your overall health and quality of life. There is no shame in seeking help. In fact, there is strength in it. You deserve comfort, dignity, and peace of mind, no matter your age. And with a proper diagnosis and treatment plan, many of these issues can be resolved quickly and safely. So don't suffer in silence. That small itch might just be your body's quiet cry for help, and listening to it now could protect your health for years to come. Bonus sign, lower legs. The silent call of your thyroid. At first glance, an itch on your lower legs may seem harmless, just dry skin reacting to the changing weather. But for older adults, especially those over 60, this simple annoyance could be something far more serious. Beneath that dryness, your body might be sending out a quiet distress signal, a call from your thyroid gland. Hypothyroidism, or an underactive thyroid, is a condition in which your body doesn't produce enough thyroid hormones to keep its systems running smoothly. It's common in older adults, especially women, and often goes undiagnosed because the symptoms come on slowly and are easy to dismiss. But one of the earliest and most overlooked warning signs? Persistent itching in the lower legs. Unlike other parts of the body, your shins and calves have fewer oil and sweat glands. When hormone levels drop, this area becomes especially vulnerable to dryness and irritation. The skin begins to lose moisture, turning pale, flaky, and scaly. You may find yourself scratching the same spot over and over, especially during colder months when dryness intensifies. And sometimes, that itch comes with a strange tingling sensation, or the skin itself may feel colder than the rest of your body. These symptoms may seem mild, but underneath, the effects of hypothyroidism can be devastating. Left untreated, it can lead to chronic fatigue, slow metabolism, heart rhythm problems, weight gain, memory issues, and even depression. For seniors, these changes don't just lower your quality of life. They can significantly increase the risk of other health complications. What should you watch for? Dry, pale, or flaky skin, especially on the shins. Itching that doesn't improve with moisturizers. Coldness in the legs, even in warm environments. Tingling or numbness, particularly at night. These may seem like small discomforts, but in the context of aging and health, they matter. Fortunately, diagnosing hypothyroidism is simple. A quick blood test can measure your thyroid hormone levels. And if an imbalance is found, treatment is often straightforward through daily hormone replacement therapy. So if you've been brushing off that constant itch on your legs, now is the time to pay attention. Your body speaks in whispers long before it screams, and the lower legs could be where the first whisper begins. Don't ignore it. According to Dr. Wong of the Chinese Academy of Traditional Medicine, itching in the elderly is usually categorized into two types. Dry itching, often caused by age-related skin changes and environmental factors. Damp itching, typically related to liver, kidney issues, high blood sugar, or infection. Dry itching is more common in autumn and winter when the air is dry. But damp itching, especially in sensitive or hidden areas, could point to serious systemic issues. Persistent scratching can lead to skin damage, scarring, and even secondary infections like folliculitis or lymphangitis. Final thoughts. Itching. It seems so small, so ordinary. But in the later years of life, it's sometimes the body's quiet cry for help, a whisper that something deeper might be wrong. And it's easy to ignore. After all, we all get a little itchy from time to time. But when that itch lingers, returns in the same spot, or refuses to go away, it may be more than just dry skin. For seniors, paying attention to where the itch appears, how it feels, and how long it lasts can make the difference between early detection and silent suffering. Armpits, the anal region, the lower legs, these aren't just random places. They're windows into what's happening inside the body. They might be hinting at hidden conditions like diabetes, thyroid dysfunction, or even cancer. The truth is, your skin often speaks before your organs scream. That discomfort you've been brushing off could be your body's way of saying, please, pay attention. So, now that you've heard these warning signs, ask yourself, which one surprised you the most? Did something in this video remind you of a symptom you or someone close to you has been experiencing? We'd love to hear from you in the comments below. Your story, your experience, might just be the one that helps someone else take action in time.